Dumeetha Luthra. She is the founder of Take Pause. She is the former BBC frontline TV and radio journalist in Afghanistan after 9/11 and then Iraq. She moved on to the UN and worked with the WFP and UNICEF. She is now the founder of Take Pause, a health tech company that helps to reduce anxiety in the pediatric population, and it has shown promising results. I'll pass it over to Dumeetha.
Hello there. Hello, everyone. Thanks, Neela. I appreciate the introduction. Okay, so Take Pause is the company that I have founded. The whole goal of Take Pause is to reduce stress in pediatric patients using virtual reality and mindfulness. And the reason I began Take Pause, as you can see, I used to be a frontline reporter for the BBC. I was in Iraq, Afghanistan, a bunch of other places, and then the UN, and was dealing with a lot of stress. And I started practicing mindfulness for myself. And I wish I'd had it as a kid, and the ability to respond rather than react. And then I went to Tribeca Film Festival in New York, and I tried virtual reality. And at the time I was volunteering with kids in the South Bronx. And I was like, how do we give them that ability in a way that they'd want to do it? And I went to Tribeca and I tried virtual reality, and I flew over New York in a virtual reality headset with gloves on. And I decided to fly straight into the ground. And when I hit the ground, I physically fell and my heart rate was accelerating. So I got really interested in the power of virtual reality. And so from that start, I founded the company. And what we've got now is a product which has got clinical trials behind it and is being used in Sutter Health and New York Presbyterian. Basically, the system's been designed with neuroscientists, clinical psychologists, and because our first focus has been pediatrics, it's been co-designed with kids. And what we've been seeing in the clinical trials and in real-world data is that 3 minutes of Take Pause reduces stress by a statistically significant amount. So stress in hospitals, we all know sort of children in stress in hospitals, it's just awful on so many different levels. They're crying, it's horrible for the clinical team having crying kids, it's horrible for the parents, it's horrible for the kids. And the impact is that they're potentially might not accept treatment, they might have to come back again. The quality of care, because if you're trying to hold a kid down, it's just not going to be a great experience. And of course, that might slow down the workflow. That might mean that you see less patients per day. So it impacts the bottom line. So what we decided to do was integrate Take Pause into the clinical workflow. What we've seen with a lot of digital solutions in healthcare is that everyone's really excited about them, but then they get put into a cupboard. So our strategy has been, how do we integrate this into workflow? And so with Sutter Health in their Pediatric Urgent Care in Palo Alto Medical Foundation, that's exactly what we've been doing. And so this is how it works. At the point of rooming, the medical team offer Take Pause. There's certain exclusion criteria. The headset is on. Then there's an opening sequence in the headset. Then we've got a self-reported scale. And the scale, the general question is, how are you feeling? And it's from very stressed to not stressed at all. And it's a scale of 0 to 10. Then the experience is 3 to 5 minutes. And essentially the experience is, you choose a world, you choose a character, and then you're breathing in and out to the character in the world. And this is actually one of the worlds behind me. And everything's been chosen intentionally to optimize for calm. So this all happens. It takes about 5 minutes in total, and therefore it's integrated into the workflow. And then what we're seeing is the self-reported reduction in stress. So this is real data from real pediatric patients. And with 3+ minutes of use, 77% of patients reported a reduction in stress. And at that point, when this was taken, the N was 120. And you can see that the scale that we're using, and for pediatric urgent care, we decided on the question of worried. Well, we didn't, the doctors decided the question of worried, because they felt that really would resonate with the kids and they would understand it. So that's the self-reported stuff. And then what I want to show you, we did some interviews with the clinical team in the context of, because of course, integrating it into workflow is essentially a Formula One pit stop. So everything's timed, a visit's timed, adding something new to it, it's got to be worth the hassle. So that was the question that we were asking, is it worth the hassle? And this was the responses that we got. And what you're seeing here actually is one of our worlds, and you can see the character breathing going up and down, and what the patient would be doing is breathing in and out to the character. And quick question, are you actually hearing the audio? Let me know if you've got any problems.
No, I'm actually not able to hear it.
Me either.
You're not hearing this?
No.
Oh, how annoying. Okay, I'm not sure how to solve for that, so I'm not going to bother. But basically, what they're saying is, let me see if I can, no. So basically what they're saying is, it's really nice to, so one of the doctors was like, it's really nice to walk into a room and not have kids crying or afraid of you. Another nurse was saying, you know, it's great, they're crying, and then you put the headset on and they stop crying, and it's just really, really nice. And then we actually got a text from one doctor, and we're seeing that and the sort of a doctor said, you know, they came in, they had high blood pressure, they gave them take pause, and there was a 25-point drop after in their blood pressure afterwards. So we're getting some really good anecdotal results in that way. And then the research team is also working to see if take pause makes sense for them. And so they're measuring patient experience. And what they're seeing is that 65% of parents agreed or strongly agreed that take pause helped their child. They've also had positive scores on impact. And then one of the things that they've seen is that there's a reduction in perceived wait time. So now these are all early initial results. They've been using it since October, and they've integrated it into the clinical workflow. So at this point, we've got an N of over 200, where they've done the pre and post scale, and it's actually been offered over 400 times. So we're really ramping it up, and we've got nurses saying, you know, it's actually, it's part of their competencies list. And they feel like now it's a need to have rather than a nice to have. And here you can see some parent responses where they're saying it's really nice. I didn't think it was going to work, but it made the visit so much easier. And it also made us feel that the clinic cared. So that's been really, really lovely. And then what we've also got is we've seen that it attracts the media. So this is actually a local news story that was done about take pause. And in this, we're actually about to go into pre-op in SUTRA again, where the patient's going to be wheeled into the OR with take pause on their head. And then there's going to be a slide out with anesthesiology. And we haven't started that yet. And the whole idea is that, again, it's going to be integrated into workflow. We're going to be measuring reduction in sedation use and reduction in length of stay. And they're doing it as a QI project. And then, so all of this is great, and it's self-reported, and we're getting great impact results. What's also fabulous, I think, and of course I'm biased, is that what we're seeing is replication of our clinical trials. So our first clinical trial was in the pediatric emergency room at Maimonides Hospital in Brooklyn. And that was a single blind randomized control trial. And the results of that, it was with 110 patients, 55 in each group. And the control was a game on an iPad. And what they saw after 15 minutes after post-intervention was that take pause reduced stress, and it was statistically significant, and it was more than by the iPad. What they were also measuring was pain, and they didn't see a statistical significance in that. And this was done pre-COVID. It was published in 2021, but it was done pre-COVID, and they were about to do a pain one. And then, of course, COVID happened. But what we did have is New York Presbyterian just recently, just in July, published a clinical trial with take pause in an adult population. And they actually saw a reduction in pain. What they said is we found significantly improved calmness during the procedure and significant physiological indications of reduced pain. And they were measuring that using galvanic skin response. So basically, our current deployments are in pediatric urgent care. We're about to go into pediatric and adult pre-op. We're also going into doctor break rooms. And with New York Presbyterian, we are we are starting a clinical trial that was due to start before COVID, literally days, like March 15th or something. And then fortunately, it hadn't started, and they're starting that now. And then we're looking at other areas for expansion, like we're talking to a hospital system about take pause for the behavioral health emergency room. We're talking about take pause for hypertension during pregnancy. There's so many different use cases that we're actually in conversations for, because it's 3 minutes of stress reduction and we're seeing an impact. And what we're getting from users is that it's really easy to use. We've also been invited to present posters on take pause and its integration into the workflow at ACAP in New York and also in Vienna at the World Psychiatry Association. So we're getting clinical recognition. So in summary, we've got something that has had clinical trials, independent clinical trials, has shown promising evidence of impact in 3 minutes, both in the trials and also in real world evidence. And we designed it for kids, and we also let adults use it too. So let me know if you have any questions. I'm here.
Great. Thank you so much, Dumeetha. I think this is an amazing idea, really important for kids, I think, as well as adults too. And I think this is something, that I've become more interested in, especially, I have younger kids as well. And I feel that anxiety has definitely gone up, especially since COVID, social media. So there's so many different factors that kids are experiencing compared to like when we were kids. So I guess I had a couple questions in terms of what is the age group, for these young pediatric patients? And then do you have to use it once, or is it something that you should be doing a couple times a week?
So the way that it's currently being used and the way we've set it up is it's as they're coming into a high stress situation, this is an immediate point of calm. So they can do it for 3 to 5 minutes and it reduces their stress in that moment. We'd like to have a use case where it's being used regularly and to see the impact on that. But we know that 5 minutes of mindfulness done every day has an impact. So, and there's a bunch of research on that. In terms of, what was your other question?
Oh, I guess, how often does it have to be done? Or
so that
the age group actually.
That's at the age group, yeah. So basically what they've been doing is they've been offering it to patients as young as 7, but what they find is the sweet spot is 10 to 14-year-olds. And then above 14, it's a bit too cool for them. but it still helps some of them.
Great. And then how about in terms of like for physicians? Because I mean, physician burnout, I mean, it's on the rise. Again, COVID is one factor, but how have physicians, been doing with it?
So when we give it to physicians, and it's always really interesting when we give it to them, the data that we're getting is like 96% of them reported a reduction in stress with that 3 minutes of use. And we're actually going into doctors' break rooms and offering it to them there. So we're setting up in break rooms. And what the hospital is actually doing is also integrating the joy of living questions in, like the assessment. So that also will be giving us data into one, how stressed doctors are at the get-go, how much take pause can reduce it, and also a broader overview for the clinics as to where the doctors are, because of course not that many actually answer the joy of living sort of provider satisfaction things.
Mm-hmm. Exactly. And it was interesting because actually a couple months ago, I just read a study that came out that said that mindfulness meditation it's now first line. It's equivalent to first line therapy, to anti-anxiety medications, which I thought was fascinating. Now we
And
have so much more. It's not invasive.
Right.
Exactly.
Right. Yeah.
And I'll open it up to the audience. I don't want to ask all the questions.
I'll ask a question if I could.
Sure.
Yeah, Dumeetha, really nice stuff. I've done some work on physician burnout in the orthopedic population and a few articles out there regarding that. And one comment I always remembered from when it was subjected to physicians, and I also think it'd probably be the same for kids, is mindfulness doing nothing more than making a stronger canary for the coal mine? In other words, are we just providing a temporary relief in a stressful situation to effectively allow more stress to be placed upon that person, individual patient, or provider? In other words, I can go to the physician break room, put on my VR set, I calm down for about 5 minutes, but then I go back to the crap that just made me need the headset. In other words, and I don't know if there's an answer to this, but it'd be really nice if some of the feedback or follow-up studies would help identify what the stressors were that led to the need to take a time out, go to the break room, put on the headset, do a little heavy breathing, and then not just go back to the same hostile work environment. Because obviously we'd love to change the environment so people reduce stress just by their workplace, as opposed to the given, which is the workplace is full of stress, it burns people out, and it sucks. So it's a long-winded question, but the idea, the real solution is not just to calm someone down in a stressful situation, is to identify what the stressors are and make the whole environment better.
Oh, absolutely. Agreed. Change the environment, hire more doctors, hire more clinical teams, give more time to the patients. Absolutely. That's not the mountain that we've chosen to climb, right? But so I would say, given those situations, what we're offering is a moment of respite. Now, what I'm hearing from you is that, well, is that moment of respite just sort of a bit dangerous because it just allows people to do more work and that they shouldn't be doing? I don't think I can answer that question, right? Because it's like, well, if we can catch them early enough, where potentially, if you're looking at it as from medical students, if you can sort of help train for resilience, if you can help train to actually say, this is an untenable work environment way before it becomes untenable, that would be fabulous.
Great.
Can I ask?
Does anyone else have questions?
Yes, me, Cheyenne.
Oh, sure.
Yes, great presentation. I have a question about scalability of creating content for the VR. So do you use any way to fast track this, do it at a scale? I was curious about that because usually
So,
that is the blocker, right? To create more content for more people.
so the way we sort of see it, and of course my background, so my background isn't health, tech, or business, but my background is in storytelling, right? And creating content in a very different way, but I know how to tell a story. And what we've decided is, rather than having a whole library of content and giving people the paradox of choice, and also it slows down the whole workflow, we keep it very contained. And so we have very specific content. And then in terms of building content, we just do it sort of slowly in the background, but because we're only offering a maximum of 4 choices at any given point, it's never too much. And then we're just swapping stuff out based on the use case and preference, because so the way we set it up is we're getting live data in the clinic every time it's used. We've automated the back end. We haven't integrated it into the health records. We're letting the clinic decide if they want that. But because we're not collecting any PHI, we get all this impact automatically. And then we can customize the content based on what's working and what isn't.
Thank you.
And the content, is it the same for the pediatric population versus the physicians?
Yes, we're appealing to the child in everyone.
Okay.
It's like it's a Disney movie, except, adults watch them too. Designed for kids and adults.
Dumeetha, good to see you. I just want to chime in as a testimonial. I tried the butterfly, so hi. And so I think it works. It worked for me. The idea is you have to focus on the butterfly. So the brain, the behavioral background of it is the brain can focus only on one thing. So if you can focus on one thing, you're going to take your mind away from other things. So for example, if right now I tell you, okay, can you agree with me that everybody's bladders are filling out with urine? Everybody's going to think there. So, and take away from the butterfly video. But I think the kids, the adults, as long as you can stay focused on what's happening on the screen, is going to take away your mind from whatever stress is there. And the way it's guided meditation, so it tells you to follow the butterfly around, I think it works fantastically. It's really very good. Simple and very good.
Thanks, Lavinia. I'll definitely try it after the meeting. And especially, I think it's so important nowadays because I feel that, we are just bombarded with so much information, like between like social media, work, email. I mean, I think there's just like so much coming at us all the time that I think it's just getting harder and harder for us to focus.
For sure.